Oh, man. Hello, world. What is up? Welcome to Build. I'm your host, Matt Forte, and we are here live at the Build Studio in New York City. As recently proclaimed by the Kelly Ripa herself, Botched is the greatest television show in the history of TV. No argument here. If you haven't been watching, you're missing out. It's a pretty straightforward show. Two brilliant doctors team up to fix the failed plastic surgeries that have crippled the lives and spirits of patients from all over the world. They do incredible work, honestly. And if you mute the really gross parts during some of the surgeries, it actually makes it a little easier to watch. That's how I do it. I'm so excited they're back. Dr. Terry Dubrow and Dr. Paul Nassif are in the building. How about that? You guys excited? I'm excited. They're excited. You can hear it. Tell you what, we're going to bring them out in just a second. But first, I believe we have a quick look at the show. So let's go ahead and run that clip.
My name is Tina. I'm from Las Vegas, and I'd really like Dr. Dubrow to build me a pigskin corset. One of the unfortunate consequences of having 2000cc breasts is I have back pain, and I've noticed that my breasts sag. Growing up in Brisbane, Australia, there is a lot of emphasis on having a beach body all the time. Me and my sister Johanna were always really close as kids. I was 2 years above her, but she had bigger boobs than me, so I used to buy lots of padded bras, chicken fillets that would pad you out. When I was 20, I decided to buy my first breast implants. I didn't even understand CCs when I went in for my first consult, or why you needed to know them. You don't really. I got 550cc solid silicone, which the doctor explained to me would stop my greatest fear, which would be an implant rupturing. After I got my first set of implants, I was very excited, but living in Australia, it gets fairly hot. I'd noticed after spending time in the sun that there was a funny smell coming out of my implants. It smells like burnt rubber. And I didn't know anyone else with solid silicone implants, so I thought perhaps it just was normal, even though deep down I knew it wasn't, and I just ignored it.
Oh, wow. Ladies and gentlemen, make a crazy amount of noise. Dr. Paul Nassif and Dr. Terry Dubrow back on the show. Back to Build. Guys, welcome back. It's so nice to have you back on the show, man.
Great to see you again.
Yeah, it's good to see you. Congratulations, new season of Botched. We're having a great time here. I'm excited to talk about everything that's going on in the show. But just first, gentlemen, how are you doing? How is life right now?
We're busier than we've ever been.
Are you really?
Yeah, we operate 6 days a week. We came on a red eye out to New York and operated today or yesterday, right before we got on the plane.
You were operating yesterday?
Yeah.
So no big plans? You weren't watching the game? You weren't?
Oh, yeah, no. That was in the morning surgery. Then watched the game, a little bit slow and boring. And what's new is I'm building a house now, and I have a fantastic girlfriend.
That's right, you do.
Yeah.
You know, we talked about you being his wingman last time you guys were here. Did that play a role? Did that factor in, or did you do this all on your own? Did you?
Now, this one was actually, I met her at a medical meeting.
Nice.
And he was not with me.
That's why it worked. There you go. That's why.
Yeah, but he probably would have ruined it for me, I'm guessing.
No, I would have approved. Yeah.
Yeah.
She's
you would.
awesome. She's
No,
a
actually,
great
you know
girl.
what? You are. That's right. You have been around for that, and he loves her, too.
You guys watch the game together as well? At some point, you got to go separate ways. If you're working on surgery all day and all that.
Remember, he's in Newport. I'm in Beverly Hills, and I had all the kids over with all the friends. Hot dogs and hamburgers yesterday.
Beautiful. No Dubrow diet approved snacks there. Doesn't sound like.
Yeah, I broke the Dubrow diet
Did you?
yesterday in a big way, yeah.
Well, it's so great to see you guys here again and have you back on the show, and I'm excited. Let's talk about this season here. 5 seasons, right? This is our 5th season now you got going?
It's true.
That's fantastic.
And we're in production for our 6th season
You're
right
working
now.
on 6 already?
Yeah.
Wow. When you look back at like the early days and the early episodes, early seasons and stuff, what's the biggest change for you guys between the beginning and where you are today? What's something, maybe not even necessarily as doctors, but something you've got better at that you do a better job at now?
Obviously, our surgery.
Yeah.
I mean, the comfort level. We always talk about this. I mean, we already are specialists in revision surgery. However, when you do this many difficult cases, obviously you get better and better. So compared to our first season, we're a little bit, are we sure we can do that? And so we did pass on many surgeries because we were worried about what was going to happen. Now, when we see patients, we say, yeah, let's just do it. Yeah. So our skills have definitely increased. I mean, we're fortunate that we're actually able to help everybody like this because they have nowhere else to turn.
Yeah.
Right. In the first season, cases, they would show us the pictures. You think you can help them. We'd say, no, that's not fixable. Now, because we're so much better and so much more experienced, we're doing cases that we, for the first 3 seasons, considered unfixable. And we're hoping that we can fix them. This is a really tough season. Season 5 is very different because it's a lot of congenital deformities, traumatic deformities that were botched by plastic surgery trying to make them better. So it's the underlying congenital and traumatic deformities plus the botched plastic surgery. So it's like botched squared.
Yeah, botched squared. That's a great way to describe it. How does that decision-making process look now? Because you said also that you just said you're in surgery 6 days a week. You're working outside of this show as well. What we see you do on the show is the tip of the iceberg. So when you're making that decision of who's going to be on the show, who's not going to be on the show, how does that work? What filters do you use in your brain when you decide, like, oh, this would be great for television? And then how do you tell somebody that?
That's a good question. You know, up until season 5, patients came through Botched casting to come to us. But because Botched is on in 160 countries, 160, we see so many Botched patients outside of the show that come on and I think, this is so unusual and so different. I say to them, would you consider being on Botched? And they, of course, say, sure, if they want to expose their lives. And we now refer cases to Botched that we want to tackle on the show.
The thing that stuck out for me in that there was I didn't realize 160. What has that done for when you guys travel? Are you international superstars at this point? Are you getting recognized all over the place?
You go to Australia.
Obviously, you get recognized around town, but now it's everywhere.
Yeah, I travel a lot because I give a lot of medical lectures in different parts of the world, and I have to tell you, the two of us are well known everywhere we go. So it is cool. You go out, like I go to Sydney, Australia a lot for my skincare, and Sydney is Australia is, I think, our 3rd largest market outside the United States. So yeah, we're pretty well known.
Did that take time for you to get used to that, or were you like, oh, I know how to handle this? Were you excited for that?
Well, you know, we had a little bit of that, of course, on the Housewives. It started.
Yeah, you've been down that.
And you know, it's always fun, and you kind of get used to it, but sometimes you just don't. And so taking photographs, you know, today we signed a photo. I mean, it's kind of cool.
I joked about this in the introduction that sometimes when my wife and I, we love this show, but sometimes during the surgery, during some of the more intense parts, we'll have to mute it. I don't know why that makes it easier, but not having the sound makes it a little easier for us to. We can still look, but if we don't hear the noise, she can't look as much, but she'll look a little bit. But something about the sound, especially like nose stuff, like when it crunches or whatever, like can't do it.
When I'm fracturing the bones.
Exactly, that's the exact moment that you can't do. Obviously, as individuals who professionally take people apart, put them back together, you have a higher threshold for that than I do. What is that thing for you? Is there a thing that you can't look at, you can't hear, you got to look, maybe it's bugs, I don't know, but there's got to be something, you're human, that is too much for you to handle. What is that thing for you?
For me, it's rodents and spiders.
Okay, that's what gets you.
That's what gets me.
Yeah.
I was always the kid that could dissect the frog, that could look at the bug. Nothing ever bothered me, and it still doesn't.
Still doesn't.
No, because the inner workings of the human body are actually not only fascinating, but it's really beautiful, the way the layers are separated. Like when you see chicken and steak, it doesn't have blood vessels, you know, going through it and blood and nerves that are active. It's much more interesting and gorgeous. It's like art on the inside of the human body.
You know, hearing you say that, can I tell you I'm grateful you use your powers for good? Because you...
You know, that was supposed to be like a fun answer, and I said like rodents, rats scare me. You know, give us something that scares you. Come on, just do it.
There's gotta be something.
Come on, you know something. And don't make a comment
there's
about me.
There's a scene. No,
about
there's
me being fat or something.
No. There's a scene on season 5 where we go try out cryotherapy before we subject our patients to it as maybe an anti-inflammatory treatment for post-ops, and Paul takes off his shirt. And that's like a little, that the Dubrow diet plus that, you're going to lose weight, I'm telling you.
There was, it was pretty recently, Paul, you had to leave the room when, Terry, you were getting fillers. I think you both were going to do it, and then you couldn't even be in the room at a certain point. Was that because of the needles? Was it because it was your friend? What?
You know what? It wasn't the needles because I do that to myself.
Exactly.
I mean, you know.
That's the thing.
But I think actually, watching those needles go deep in his face and he just sitting there smiling, I started getting a little bit lightheaded.
Well, that's because you knew he was going to do it.
Plus, I don't want to do
You knew it was
so I
coming
ditched.
next.
Yeah, I said
Right.
no way. I couldn't do it.
And so he knew, oh my gosh, that's
I'm a
about to
wimp.
happen to me, and he's a wimp. I have-
Botox, one thing. Fillers, I don't know.
yeah, he has a very low pain threshold.
I'm a baby.
Yeah.
Does do the filler needles have to go deeper than the Botox needles? Is that it?
Yeah.
do.
I mean, Botox just goes just
Just
beneath
right on the
skin.
surface, and the fillers.
Just in a
they
little
go
small
deep.
baby needle. That's
My
good.
God. You, sir, speaking of high thresholds, you were like, this hurts a lot. Like, is that part of your coping mechanism to smile through the pain?
I
'Cause
have-
you didn't really express what looked to be
He's a
terrifying.
masochist. He loves that.
I have a very
actually
unique.
enjoy it, though.
I have a weird relationship with pain. I sort of weirdly like when I go to the dentist and they're working the gums, and I'm going, yes, bring it. I don't know why. I kind of amuses me.
That's a weird superpower for you to have.
Yeah.
Yeah.
That's, I think, one of the reasons I'm able to, honestly, stand for 5-6 hours straight and not take a break and not stop moving. And even though it's painful, I kind of like it that I'm not, no breaks. It's
Sick man. Sick, abnormal man.
Shift gears for a second. You mentioned when you went to check out the cryotherapy and all that. There's so many different advancements and stuff. What's like the one thing you hope to see in your lifetime that we haven't seen yet, with all the crazy stuff that we do see every year, all the new techniques, all the new tools?
Well, I hope two things. One, I hope to see plastic surgeons be put out of business, because basically what we do for a living is tighten skin most of the time, at least in cosmetic surgery. And it's kind of brutal that we're still cutting and pulling and stitching. I mean, if you would have told me when I went to med school in the early 80s that in 2019 you're going to be using stitches through the skin, I said, nah, we'll be using lasers by then. But look, we're still doing it the exact same way. So I hope that goes away. And I hope some of the operations that are being done that are very popular today go away, like fat transfer from the abdomen to the buttock, because that's too dangerous.
A lot of people seem to request that. That comes into, I see that anytime I watch a show, like it feels like every other episode somebody's coming to ask you to do that. And then it was actually, I think it's the same guy, it was the Lip King who wanted that, I believe. And he also said, which I thought was really interesting, he was like, Armenian noses are really in right now. And he was talking about like trendy things. Do you ever worry that when someone comes in for a trendy thing that they'll get tired of it, they'll grow out of it, they'll change their mind?
Yeah, but remember, we don't do that, though. So someone comes in with something trendy, we don't do it. I mean, we're going to do something that's going to actually just match with them. Yeah. And so that's one thing, we don't fall into that gap. We don't ever fall into that trap.
It's true, you guys don't, but there is a thing that I was curious, like we see with Tina, where that was in that clip. You guys were great with her, and you gave it to her straight, and you did everything you could. You were like, look, this is a terrible idea. You're heading towards a path of disaster. But she was saying, yeah, I hear you, but I'm smart, and I'm going to make my own decisions. You guys can only do so much. How do you, after she walks out that door, how do you process that? You know that she's heading down a bad path. You can't do any more than you already have. Do you have to just keep moving forward? Do you worry about her? Do you not allow yourself to because there's too many people?
It's a very good question. We know in a lot of these plastic surgery addicted patients that despite our warnings, they're going to go ahead and do more anyway. So on camera, we give them the warnings. We try to be very kind about it. And then off camera, we sort of look at them again and say, okay, we did that on TV, but that's, even though the cameras were on, nothing's really changed. We really, really don't want you to do it. It's really a big mistake. And then maybe show them pictures of disasters that have occurred. And that's the good news about Botched. It's really a cautionary tale as to what not to do in plastic surgery.
I gave her a little bit of tough love on that episode. They didn't show it here, but I started getting upset because she wasn't listening. I mean, her sister got pissed off at her. You know, he was giving her the information, but he still was very nice about it. I got frustrated. Yeah. And then I just kind of, give her my thoughts.
No, it was great to see because you were watching her. It wasn't sinking in. And so when you turned around, like as an audience member, I was like, thank you. Somebody tell her.
But remember, and everything we do, I mean, none of this is contrived. We're sitting there with the actual patient. We forget about the cameras. So this is exactly what we would do if we were in our office and the patient was like that. Again, we may handle it differently, but I'm the tough love guy. I'm very, very good at doing that. And sometimes maybe it works, sometimes it doesn't.
Yeah.
But it's interesting how when you have that plastic surgery addiction or you see maybe a little bit of body dysmorphic disorder, for example, making your breast that big, doesn't matter if it's going to pop out of your skin, I'm going to do it. Yeah. And that's dangerous.
Forgive me, did I get a chance, Paul, to find out what you hope to see in your lifetime, what you want to see in the future as well? Did we get that? I don't think we did.
You know, in these great movies when you see, it's a science movie, I mean, it's a science fiction, and they have, you've died or you're actually lying on the table and they take this laser kind of thing and they fix your whole body.
Yeah.
Gunshot, your whole, you destroyed broken bones and everything's fixed in like
The magic
4
beam.
seconds.
Yeah.
That's what I want to see.
That's what
Like
you
Star
want-
Trek.
Yeah, exactly.
Like Bones used to have that thing. Zzz, okay.
And that was it. You were
Diagnosed and
done.
you're fixed.
Yeah, I guess we all would want to see that. Yeah, that'd be pretty
Damn
cool.
it, Jim, I'm a doctor.
Yeah, that would be nice to have, wouldn't it? I can think of a couple of applications for the magic beam. Yeah, 100%.
Especially eradicating cancer. I mean, there's so many things, though, and that's what I feel sometimes they'll be able to find it, locate it, and just zap it. That'd be so cool.
That would be cool. Do you think are there people working on that? And like, where do you even start with that?
I have a friend of mine who actually, he backs financially these almost Nobel laureate type of scientists, and with all at the different universities, from Caltech on stuff, and some of the stuff that's going on right now with genetics, and it's so interesting, and it's far than we even know right now.
But
so it's going to get better.
There's no question technology is changing cosmetic medicine, and we are finding ways to tighten skin now with radio frequency, ultrasound, lasers. It's still not there yet, but I doubt 25, 50 years in the future that we'll be cutting and pulling anymore, don't you?
I agree.
I doubt it.
Now, and you say that, right? But one of the things, because I see this and I watch the show and I'm amazed by all the technology, but recently, then the leech lady came out.
Yeah.
And like, I was like, wait, the what lady? First of all...
Good old medieval times.
Yeah, exactly. There's a practice that we have seemingly not improved upon, right? Like that just works. When you need
Absolutely.
that exact thing, you bring in the leech lady. I'm made of leech lady questions right now. Is she a 9-to-5 job, Monday through Friday? Do you always have the leech lady there?
I mean, remember, she's close to me, and I use her probably about twice a week because I do these. I mean, I just used her on Friday. So I finished the surgery, and this was a patient whose nose was pushed in her face. I pushed it out to rebuild it and make it longer. And then at the end of the case, I look at the tip, and it's turning purple a little bit. I go, get her on the phone. Boom. Put a little nitroglycerin on the tip and call the leech lady. She will go over to the aftercare facility, 9, 10 o'clock at night, and I use that frequently. I know you probably use it, obviously.
I
too.
use it on breast sometimes, but the key is that it's a very simple concept. There's oxygen and blood going into tissue, and that deoxygenated blood has to come out. When it gets congested, when it can't come out, that can block it from coming in. So to take it out, really the best way is to put a leech on there, let them suck it out.
They suck it out, then they inject something, an anticoagulant called Hirudin, and what that does, it helps keep that blood flowing. So it's actually, remember, I'm a head and neck surgeon originally, and in head and neck cancer surgery, when we put in these big flaps of tissue to fill in a cancer defect, that is what helped to get all that blood out, the blood flow like we just talked about. Using it for years.
Exactly. You got to
I
imagine.
still use maggots,
Wait, really?
Yeah.
Let's explore this slightly. What do we do with maggots? Why do we use maggots?
For necrotic tissue that's dying, and if you need to debride
we're
it
getting
or
real
remove
gross.
that dead tissue, they still use maggots.
Who's they?
Who's the maggot lady?
Yeah.
They still use that.
Right.
They still.
But the reality is, if they have necrotic tissue,
Remove it surgically.
We
Come on, that does
maggots?
sound great, though.
What
Don't you remember all
planet-
those movies you saw that
what
on the maggots? come
planet
out?
are you living on?
it
They
was a good
still
story.
use maggots.
It was
What?
a good story.
Well,
Come on.
maybe.
I like that. Can you imagine
By
that?
the way, they don't still use maggots.
They do in the movies.
Yes, I know, but not in real life.
Well, that raises another question that I have then, which is you see a lot of people coming through. They'll go to Mexico, they'll go overseas, they'll go elsewhere to do something that we don't necessarily do here anymore. It's usually driven. It's financially. Like, oh, it's really cheap. I can afford it over there. And once in a blue moon, always anecdotally, they know someone who was fine and had a great time. They always know someone who had no problem. But it seems like majority of the time it goes awry. I imagine it's not a best practice. We don't condone. But is there a way to do that to approach it safely, or no? It's just you can't control so many of the variables when you explore those options.
So you're talking about medical tourism, basically.
Basically, yeah.
It's going somewhere out of the country to have cosmetic surgery at a much less costly price. The problem is, in this country, healthcare is the most regulated industry of all. And there are advantages to having a very regulated industry. I mean, it's very closely looked at. If there's a problem, you get in trouble real fast. When you go overseas, you don't know what you're going to get. It may work 2 out of 5 times, 3 out of 7 times, but if you're 4 out of 7, it's not working, you have no recourse, and then you're stuck. You're left over there. And then when you come back with your problem, except for guys like us, nobody wants to deal with you because you went overseas and that's your problem.
Yeah.
It's never a good idea, in my opinion, to have medical tourism, ever. Always do it in this country.
So I'm going to say something a little bit different, because I have a lot of friends that are surgeons from all over the world. Remember, I go and I lecture at these different, so I watch them operate. A lot of these surgeons are fantastic, very innovative. To me, it depends on actually where you're going. And if you're going for the lowest priced, and that can happen here in the United States too, but you go for the lowest price, and let's say you do go south of the border. Even though there's some fantastic doctors I know out there. But it really depends, in what I feel, is if you go to look for the cheapest surgery, that's when you're putting yourself at heavy, heavy risk.
There was one young lady here on the show who her sister went, had a great time, and then she went. She didn't ask any questions or anything. She was like, "Give me what my sister had," and it was a big mess. And you guys were able to really, really help her out and save her life there. I'm getting this thing. I got to wrap it up in a second, but I had one last silly question that always cracks me up. Who's writing the names for these people? We had Boulder Holder was one. Some lady came in. She's like, "I got Frankenboobs." There was another. Like, who's coming up with all these ridiculous? Do you guys ever weigh in on that? You got a team of writers and producers writing the names down?
We try not to look at those names. Yeah.
But they are funny.
They are funny.
Yeah.
But in the past seasons, we've had an occasional patient see that and not be that happy about
Yeah,
it.
you got to figure.
You got
Sometimes.
Right. I mean, it's funny about this
You have a
season of
favorite?
Botched. It's very serious, but this season 5, is particularly accidentally funny. There's a lot of funny things that naturally happen that are really comedic for whatever reason. So this is a really fun season. It's a really tough season. I'm glad it's over, to be honest with you, because it was so hard and so scary. Remember how long it was?
Oh, yeah.
It was brutal.
Like 9, 10 months, wasn't it?
Yeah, and the season we're doing now is going to be 12 months long.
My God.
Yeah.
And you guys, you were just saying this earlier. You push yourselves. You work harder, not just because you're on camera, but primarily because you're trying to what's the word I'm looking for here? Grow as doctors, almost like you're growing your confidence, you're growing your skill set, and you're pushing yourself to see, oh, we could do anything at this point. Because that's the feeling we get at home. Is like these guys could do anything.
You know, we will, because remember, these people have, these patients have nowhere else to turn. And so, as Dr. Dubrow mentioned, we go to that extra limit to see, can we help them? But there's still patients that come in, we say no, that we cannot help them. Still can't do it.
Very rare, though, these days, I think. Very rare. I mean, patients call us, it's so funny, they start to see us as white knights or like gods. They call us gods. And you know what I say when a patient calls me God? I say, yeah, I know. No, I'm kidding.
You hate it.
No, I don't say stupid stuff like that. That's all,
Well,
he loves,
At least
remember,
on camera you don't. You do in real life.
I never do.
I'm not
do
filtered.
Do that. No, I don't.
This is like
I don't.
filtered.
I'm very humble.
Here.
He's not.
Oh, you're humble?
No.
Yeah.
I can get a little tough with patients, but I am.
I'm very sweet. You're not so sweet.
No.
That's
no.
the truth.
Well, yeah, but at least I'm. But I'm a very good-looking, sweet dog.
Oh. Anybody who tells you how good-looking they are, guess what? By definition, they're not good-looking.
I could watch you guys yin and yang like this all friggin' day, but unfortunately, I gotta let you go. I gotta wrap things up. You got work to do. You gotta get out there. But before you go, like I said, if you're not watching the show, you're missing out. It's so damn good. You guys, you genuinely do incredible work. You make such a difference in these people's lives, and it's amazing to watch. So thank you for that, and thank you for this show, guys. It's airing Wednesdays at 9 p.m. Eastern and Pacific, only on E. It's Botched. You should be watching it. Make some noise. Speaking about things you should do. Get crazy right now. And join me in thanking Dr. Paul Nassif and Dr. Terry Dubrow for being here once again. Thank you guys so much.
Thank you.